Hi, and welcome to InFocus. This is Jabbar Al-Obaidi. In this episode, we'll be talking about something I think concerning the larger community and also some patients, and that's the issue of Alzheimer is a disease that still I mean, there are different theories about it. Some they said it's under control, it's treatable. Some they said it's beyond reach. But there is hope because we live in 21st century, and you know, especially we are in Massachusetts. I think we are fortunate to have all these technology, all these knowledge, medical knowledge, and different teams to deal with this disease and also treat people the way that they should be. With me in the studio, two colleagues that they can address this issue, and probably if you need some answer to some of your questions, you're going to see their email address on the screen as well as mine, and then we can communicate after you watch this show. So as I said, in the studio I have with me Leslie Barbosa, volunteer with the Alzheimer Association and president and CEO of this is Josie's Village. Josie's Village, thank you. Josie's Village, and Pamela Schwab, senior director of development at the Alzheimer's Association MANH chapter. What's that MANH chapter? Massachusetts and New Hampshire?
Correct.
Okay, so Massachusetts and New Hampshire, because people they don't. Okay, so what's brought you to this area? Are you specialists? Are you just activists, or what's the story? Please.
Sure. Well, I work for the Alzheimer's Association. It's a
as a volunteer?
As a professional staff person.
Okay, go ahead.
Yes, as a professional staff person. And I started with the association about 7 years ago on the fundraising side. And I also do community outreach, and that's how I met Leslie.
So, Leslie, what brought you to this area as well? So I know, you know, you're a professional and you're doing this for 7 years, and yourself?
Yeah, so personally, I was a caregiver to my mom, Josie. So I took care of her for 11 years in my home, and she had 3 types of dementia. She had Alzheimer's disease, vascular dementia, as well as Lewy body dementia. And I cared for her in my home for 11 years. And because of that and my journey through dementia with my mom, I knew that I needed to work with the Alzheimer's Association as a volunteer.
Excellent. Thank you for your service and also for volunteering for this. So as I said in the beginning, you know, people are very scared when they hear the word Alzheimer. Why? Is it treatable? Is it about to reach that level of treatment? Or how people you know, should understand this? So when they understand the magnificence of the issue, then they can probably take care of their patients, you know, their mom, as in your case, or their relatives, or their friends, or dads, or whatever.
Sure. So there's no cure currently. There are 2 medications that can slow the progression of the disease, and currently the second medication has just been is going through the traditional trial that the FDA puts medication through.
Yeah, they talk about it just especially last year. There's a lot of news about this.
Yeah, so there were 2. So aducanumab was the first medication that was approved by the FDA.
Yeah.
And then the second medication is lecanemab, which is seeing better results. And so right now we're awaiting for Center for Medicare Medicaid Services to hopefully fund the medication. Both those medications are not funded by Medicaid, Medicare services, and so we are yelling from the tops of our lungs.
We are yelling with you on this, but why they don't include that in the mitigation?
So the first medication was approved by the FDA, and so if you were available to be part of a clinical trial, you could have access to the medication. But if you also had an extra $30,000 in your coffers to support that medication, you would have access to that medication. It's the same.
It's very expensive.
It's very expensive, and it's the same with the second medication. And so, for the first time in the history of CMS, which which supports Medicare and Medicaid, people with heart disease, people with cancer, people with HIV/AIDS, they have access to medication. And so right now, as of late Friday or late end of week last week, we now understand that FDA has gone back to their traditional trial, and they have an advisory council that is endorsing this medication, and we believe that this is another great step for people. Now, this is not a medication that will cure the disease, but it slows progression for early stage and certainly for mild cognitive impairment. But I must also say that it's not a medication that is for everyone. But we feel CMS has been highly discriminatory against people that can't afford the medication and that are not near a clinical trial, but are
discriminatory on what basis? You
on the basis of not having the extra income to afford the medication.
Clearly.
And so right now we're hoping on July 6th they will change their decision and start supporting those in need, and left to the patient and the doctor. And again, not for everyone, but
that
for
depends
that
on
decision.
their doctors and
Yeah.
if they see it's okay for them or not,
Exactly.
to prescribe it. Now, so this is important for our audience to understand. When did you when they diagnose the disease in case in your mom, and then they discover that she's going through that, or do you as a family started to notice that?
Well, I guess, I started to notice things with my mom. My dad had passed away in April of 2009. And, she was showing signs of abnormal behaviors, but she was also in deep grief. My parents...
Sorry to ask you about a little bit details of it. What kind of abnormal behaviors? I think this interview is just not just for promotion for the knowledge, but also to make sure that the audience understand, to pay attention to their elderly and seniors, ones in the family, or again, relatives or friends.
Sure, yeah. So with my mom, for example, she was watching television, and there was a Dr. Sanjay Gupta was on.
Yes.
And he
CNN.
was about my age. And she said, "Oh, I used to work with him." Now, at the time, my mom was, in her later 70s, and she used to work at Quincy City Hospital years ago. And I said, "Well, Mom, he's my age, so that couldn't have been possible." And I said, "Well, maybe it was his father, because his father did work at Quincy Hospital." And she said, "Oh yeah, that's right." So there was little things like that would pop up here and there that made me wonder what was going on. But then she started falling quite a bit.
Okay.
And she had a very bad fall. She got tangled in her bed sheets when she was getting out of bed, and she broke 4 ribs and collapsed part of her lung, and went to the hospital. And when I got to the hospital, I didn't recognize my mother. She looked old. Her face was sunken in. She was extremely confused and combative. So she spent a week in the hospital. The nurses would have to bring her out into the nurses' station in her bed, on her bed, and because she was pulling her IVs out of her arm.
Okay.
And this was totally uncharacteristic of my mother. So at one point, towards the end of her visit, her stay at the hospital, the doctor suggested she go into a geriatric psych unit to be evaluated. Now, I had never heard of such a thing, but I figured, well, this might be something that could help with whatever is going on with her. So she went into a geriatric psych unit at Morton Hospital in Taunton, and after about a week, the neuropsychiatrist sat me down and told me she had vascular dementia and she needed 24-hour supervision.
Okay, so this is for you. What's the difference between dementia and Alzheimer's?
Sure. So Alzheimer's is the more common form of dementia. It's a degenerative brain disease. Now, dementia, it's an overall term for a group of symptoms, so there are many forms of dementia. And I feel like it changes often as we continue with our research.
And so, what most the cases comes from is dementia or Alzheimer's?
Well, there are roughly 6.7 million Americans diagnosed with Alzheimer's. I feel there's probably more with dementia or mild cognitive impairment, which doesn't always necessarily lead to Alzheimer's. Early diagnosis, we feel, as well as prevention. We're seeing that we want a healthier brain today, so we want a healthy heart, can lead to a healthy brain in making better decisions overall to prevent the disease.
So, what kind of association offer to the patient?
Well, gosh, I know Leslie could probably speak to that.
Yes. So the first year that I was taking care of my mom in my home, I knew less than nothing about dementia and Alzheimer's. And she was saying 1 minute, yes, she would do something, but then the next day, no, I never said that. And so it was very perplexing to me. So I reached out to the Alzheimer's Association. They do have a 24-hour helpline. And it was the Alzheimer's Association, the woman that I spoke to, who really helped me through that first year of caring for my mom. They would give me strategies to try with my mom.
Yes.
And a couple weeks later, they would call me back to check on me. A few weeks after that, call me back again to check on me. So I never felt alone during that first year, which can be caregiving for someone with dementia can be a very lonely existence. So I was fortunate to be able to have the Alzheimer's Association.
Yeah. So Pamela, can you speak to the relationship between heart disease, brain disease, and
Sure.
so people can understand that?
Sure. So one of the studies that it's a trial study that we are funding currently, we think that modifiable risk factors, so people at risk are people that are isolating themselves, people that have vascular issues and poor diet, sedentary, no exercise. We feel that with this pointer study, there's a location here in Rhode Island in the Northeast where we've taken a sample of people at those we call modifiable risk factors. And modifiable.
Okay.
So that we can get them moving. We can give them a better diet, more of a Mediterranean diet, a diet that's great for their heart, we feel is great for their brain.
How many at a time you can take?
In the study?
Yeah.
The study's closed right now. I'm not sure about the numbers, but I think maybe a couple hundred.
Okay.
And there are 5 different locations throughout the United States. It was
So good sample.
It's a good sample, and it was a study that was conducted. It was called the Finger Study in Norway, Sweden, and the results were so profound they stopped the study and really wanted to share results. And so we adapted that study here in the United States, have funded the study, and are really looking forward to seeing those results. I mean, I say, wouldn't it be great, you can take cholesterol medicine for your heart and for your body. Wouldn't it be great if you could take a brain cholesterol medication
Of
for your
course,
brain?
that's the hope, right?
At some point. So we find, or our researchers have been finding that if it's affected the heart, it's affecting the brain vascularly.
Yeah. Now, did you notice that too? That she have? I'm sorry to circle back to
That's
your,
okay.
Mom. I'm sorry for your loss.
Thank you.
Did you feel that she has like a weak heart or the problem with her heart, or no?
No, my mom had a very strong heart up until the day she died. But I believe that my mom had a gene called the APOE4, which is known as the Alzheimer's gene. And it's not a determinant gene, which means, it doesn't necessarily mean that you will get Alzheimer's with this gene, but it does increase your risk. So if more people know if they have this gene, they can maybe do like what Pamela was saying about, taking care of their heart and their brain, which is really one. Maybe we can ward off the disease a little bit longer.
Should senior people, they go or at a certain age for that, of course, and they go and say, okay, I want to make sure that I don't have Alzheimer, and I want some probably medical advice, or you will go through a certain process. I mean, when with cancer, people they go, chest cancer for ladies, for women, they go
prevention.
The prevention to prevent that to happen earlier. Would that possible in your opinion?
I don't think there's a test to really understand everyone's risk factor. As Leslie was saying, even if you have this gene, it doesn't necessarily mean you will get the disease. And so I think it's been sort of misnomered in society that people don't want to know. And that's, I think people can be very courageous and want to find out. But I think that if we can live every day knowing that, we have one body, let's take care of it. I think it's helpful.
So are you calling for people actually should know about their body and what's going on in their body?
Well, I think just as
it's
easy,
better than
just as easy as I have
sleep
high
on things
cholesterol,
and you don't
right?
know.
Yeah, or I have sleep apnea. I have things that could really be a detriment to my body. Of course, I say that's easy to say. Not everyone wants to know, and even
but that's a good advice,
But even talking about cognitive impairment or having memory loss, there's such a stigmatism in society today that it's unfortunate. People are still afraid. It's like the cancer word years ago.
Yeah.
But we're finding that even with mild cognitive impairment, you can change that. Like you can delay or sort of fix your impairment with proper
a good word,
education
word to fix that,
nutrition.
But you need to come to realize and to acknowledge that it could happen to you. And you need to take the right procedures for that. Now, what do you want to, the audience to know, or how they collaborate, or how, what things that take next steps or take some actions that will help your association and also your work in terms of reaching out to the community or larger communities?
I mean, one of the easiest ways to get involved is to become an advocate, and that's writing a letter, that's sending an email.
Spell it out.
So
I mean, what
easy.
you
Yep.
advocate? What
Very
that
easy.
Okay.
And advocacy really changes the amount of research dollars on a federal level. It's increased 7 times in the last 8-10 years. We went from $500,000 to $3.5 billion. So I mean that changes with voices. And then also, Leslie came to us and then went full in on our Walk to End Alzheimer's, which is our largest signature event to raise funds for our association.
So how people get involved to raise funds and help with this?
Yeah, so for me, it was actually, my mom passed away just before the pandemic. So, and every year I would reach out on Facebook to my friends asking for people to send her birthday cards. And her birthday was in March, and she passed in February. So instead, I reached out to Facebook friends and asked them to make a donation to the Alzheimer's Association. And I thought I might raise a couple $100. And within 3 days, I raised $1,500. And I was shocked. So from there, I always knew I wanted to be involved with the Alzheimer's Association. So the following year, because of the pandemic, I started my own team called Josie's Journey, and we are a top fundraiser for the South Shore Walk in Plymouth.
Yeah.
And so every year now.
So how people can reach out to you guys, and then if they gonna give some donations or ask questions and things. Yeah.
So the website for the walk is actact.alz.org. Our helpline number, and that's 24/7. It could be you're calling because you just are not sure why you're calling, but you're calling and you just need some help. And that's 1-800-272-3900.
Repeat it again, please.
Sure. 1-800-272-3900. And then the website is act.alz.org.
Now, there are other occasions that you do the walk, or just one annual walk, or what does that mean for the people?
So in Massachusetts, there are over 600 walks throughout the country that take place throughout the year, but mostly in the fall, throughout all the United States.
So they can reach out and say, okay,
If you're not just here, you could do one in California, you can do one in New Mexico, you can do one really.
So the association is throughout the other states.
Yes,
in
it's
the
a
United
national.
States.
National. Yes. Yep.
Not international.
We have international ties, but the Alzheimer's Association itself is incorporated in the United States.
Yeah, because that will help too. I mean, some people. You see, as you said, Leslie, I think people, they have hearts, and always when you ask them for noble cause like this, people, they wouldn't say, I'm not going to pay the $15 or $20. And I mean, every dollar will help,
Sure.
right?
Absolutely.
Yeah. So, do you have recent cases that they need immediate help in terms of funding because but what you raise very important a point that people, they need for this new medicine, like if they approve it, $30,000,
Right.
and people, they don't, we think people, they have $30,000, but they don't.
Not for right. Not for
Right?
Sure.
Yeah, I mean, for majority, probably it's very hard. So how we can handle this? You thinking about any resolution for that?
Well, as I said, on July 6th, we're hoping that CMS is
July 6th,
July
2023.
Yes, in a few weeks. We're hoping that they do approve this next drug, and again, that will be between your primary care physician and you, the patient,
Okay.
to decide if you're eligible, and then if it's something that can help you with your symptoms.
So eligibility question is based on their insurance or the.
I think the diagnosis.
The diagnosis.
And again, if it is approved if you want to spend the money.
Yes.
But for people with Medicare or Medicaid,
Yes.
It would be helpful for them if it is approved.
Well, Leslie, you know.
Yeah, I am just waiting for approval from CMS. We are fighting, you know, for
Fighting-
all
fi-
Alzheimer's patients.
Fighting with whom?
I'm sorry?
Yeah, fighting with whom?
With the federal government.
With the
Yeah, say it, you know,
yes,
yeah.
We're
Yes.
fighting. We're fighting for people's lives. We're fighting for more time. # more time, so
More
that
time.
people have more time with their families. And that, again, this is not a cure, but it will get that person to their daughter's or son's wedding. It will give them more time with their family.
As you said, reduce the progression, so
Yes.
delay the progression for that,
Yes,
right? So
yeah.
this is an important stage, I think.
It's very important.
Yeah.
Very important.
Any last message you want to, both of you, say to the audience directly?
Sure, get involved. Be an advocate. If you can't give your time or your money, just please be an advocate and help us move our cause.
Yeah. So define, being
Being an advocate is
yeah.
sure. It's just again going to our website alz.org and logging into the system and saying yes, I want to support those that don't have a voice.
And I think for me, the Bridgewater community and towns all around have been so supportive of me and different things that I'm doing. And if you want to join my team, Josie's Journey, I would love to have you. We are having a fundraiser at Crispy's Italian Cuisine on Wednesday, June 21st from 5 to 8 p.m. And they are generous enough to, give back some of the money made for my walk to end Alzheimer's.
Well, thank you so much, Leslie Barbosa and Pamela Schwab, for this service. And again, this is a noble cause, and I think I encourage really our great audience to get in touch. You have the website, also you have the email address, and let's work together as a team. Thank you so much for watching InFocus. This is Jabbar Al-Ubaidi.